A short course on Medicare. Hi, I'm Kevin Knaus with InsureMeKevin.com. And if you are new to Medicare, it can be a little bit confusing with all the different parts and plans and different things you need to put together. However, Medicare, original Medicare, is pretty good health insurance. Now, if you had one of those really nice employer-sponsored health plans, or perhaps you had one of the Silver 94 health plans from the exchange, those are pretty good darn health plans as well. And so you may see some of the costs rise for your out-of-pocket and some of your monthly premiums. But there are ways to mitigate that. But first, let's look at what original Medicare is. Part A is your hospital, skilled nursing, hospice, and home health care coverage. And there will be a deductible if you are admitted to a hospital under Part A, which is about $1,556, I believe, for 2022, and that goes up a little bit every year. That deductible of $1,500, that covers the first 60 days in the hospital. So that's pretty nice. Then there are co-insurance for days over stay 61 and beyond. And the first 20 days, if you're admitted to a skilled nursing facility, there is no cost under original Medicare Part A. There is a co-payment for days 21 through 100. And Medicare only covers 100 days of a skilled nursing facility. So Part A isn't too bad, and if you have worked, I believe they say 40 quarters or 10 years where you've paid into Medicare taxes, there will be no premium for Part A Medicare. So that's nice. Now, the big part for original Medicare is Part B. That covers the outpatient services, your doctor visits, labs, tests, durable medical equipment, the things that really most of us are using on a weekly and monthly, yearly basis. There is a $233 deductible for Part B in 2022, and again, that will go up a little bit every year. Once you have moved through that $233 deductible, you then go into 20% co-insurance, which isn't, if the doctor visit is $100, you would be paying $20 after you have met that Part B deductible. Now for 2022, the premium for Part B, if your income for a single adult is under $91,000, I believe it's $182,000 for a couple, is $170.10. So that's a cost, and it may be higher than what you're paying now. But it is fairly inclusive with this Part B, and it also covers the preventative services. Now, there is one big downside to original Medicare. There is no maximum out of pocket for either Part A or Part B, whereas we normally associate with a health plan, once you hit a particular amount, maybe $4,000 or $6,000, the health plan covers everything for the rest of the year. That does not work in original Medicare. So you can incur that Part A hospital deductible several times during the year. And certainly, probably the biggest thing for people is that Part B 20% co-insurance, which for a normal year may not be that bad. But if something happens where the doctor is ordering lots of tests and expensive imaging and therapy or outpatient surgeries, it can start to rack up. Even at 20%, it can be quite onerous to someone's budget. So that's one of the downsides to original Medicare. The other issue is that original Medicare Parts A and B does not cover prescription medications from a retail pharmacy. It does cover drugs administered when you're in the hospital and some drugs in a doctor's office. But your daily maintenance drugs, for cholesterol medications and whatnot that you get from a retail pharmacy, they are not covered. And there is a separate part that we'll talk about that does cover those. And so that's one of the things that makes it confusing. But original Medicare, Parts A and B, once you're eligible when you turn 65, is pretty good health insurance. But of course, we need to remember no maximum out of pocket and no prescription drug coverage. Part D, prescription drug plans, D for drug. Now, they are not handled by the federal government. They are administered by private companies. And you need to enroll in a Part D prescription drug plan. Otherwise, you may face a late enrollment penalty. And that can be 1% of the national average, and the national average of the Part D prescription monthly premiums right now is around $35 per month. There are plans that are lower and there are plans that are higher. Now, in general, all of the plans are going to cover a wide variety of drugs, and more than likely, most of your drugs will be covered. However, these Part D plans are kind of confusing. Some of them can have a deductible. Then you have your initial coverage phase where you go into co-payments and co-insurance, which lowers the cost of the drugs. Then there's a coverage gap where you pay 25% of the retail price. And then there's a catastrophic coverage where all of the drug prices drop precipitously. And some of the differences between the different drug plans is generally some drugs may be in like a very low tier, like tier 1 or 2 tier, but in another plan they may be tier 3, so you'd be paying more. And it's kind of a shell game in trying to extract the most amount of money from Part D members. But if you're not taking any prescription medications, you can look for, tend towards the least expensive monthly premium. Now, the trick is to go to Medicare.gov and put in your prescription medications, and the Medicare.gov Drug Finder tool will show you all the different plans and rate them by your lowest annual out-of-pocket cost for both the premium and the drugs. So they combine those. Now, one thing to remember is that pharmacies play a big role in this. So if you do have a favorite pharmacy, you'll want to include that as your preferred pharmacy, because it is interesting that sometimes if you change that, different plans become lower because there are special preferred pharmacies and special preferred rates, and you don't want to go to a non-preferred standard pharmacy because the prices may be higher. But that Part D prescription drug plan covers those retail pharmacy prescription medications that you may be taking and may have to take in the future. So it's a very important part and kind of completes the overall Medicare health insurance package for you. And if you have original Medicare and your Part D, you're good to go. That's kind of all you need for the most part. But of course, there may be other instances where you want additional protection, and we'll talk about that next. Medicare Supplement or Medi-Gap plans. As I mentioned earlier, original Medicare Parts A or B does not have a maximum out-of-pocket amount, so you can be subject to very high annual amounts for different healthcare services. So there are these Medicare Supplement or Medi-Gap plans. They're standardized by the federal government in terms of the benefits for most states. There's a few states, I think there's 3 of them that have some different plan benefit designs, but they are lettered: Plan A, Plan B, Plan G, and not to be confused with the parts of Medicare, Part A, Part B. Now, these plans cover different Medicare cost sharing. So some plans will cover the Part A deductible. Most all plans cover the Part B co-insurance. And none of the plans, if you're turning 65 in 2022 and beyond, will cover the Part B deductible. Those are, if you turn 65 before 2020, then those plans are available to you. So as the plans cover more of the different cost sharing, such as extra stays in the hospital, the medical deductible for Part A, they increase in cost. But what's nice is that a Plan A will be exactly the same between two different companies. Really, the only difference is going to be the monthly premium amount, and sometimes the supplement plans have little extras, nurse on call and gym fitness, but they can be very helpful to providing you some security that original Medicare, with all of the costs that are not capped, will bankrupt you or severely impact your savings. But you need to look at the monthly premiums, and they, depending on where you live, can, a low Plan A might be 50 or 60 bucks a month. Plan G, that covers everything and has some foreign travel coverage, that can be upwards of $100, $125, $150 a month, and they will go up every year for your age. And sometimes the companies, there's an inflation percentage that's included. You don't need to have a Medicare supplement, but it can be nice if it's in the budget. But you do need to look at the cost and the benefits of that. Now, one of the great things about Original Medicare is it's kind of like a giant PPO plan. So if you're in California and you want to see a doctor in New York, as long as that doctor accepts Medicare assignment, you can go see that doctor and have whatever healthcare services or procedures that are performed, and Medicare will cover it, and your supplement will cover the cost sharing within the plan that you have purchased. So you can go, you're free to roam, as opposed to some health insurance plans, that we have today, that you just can't go out of state. So that's very nice. When you have a Medicare supplement, you're still in Original Medicare. Original Medicare pays first, and then the supplement is just covering the member cost sharing outline in the particular plan that you bought. So it can be a good deal for many people that are traveling around. But of course, there are monthly fees associated with it, and you need to consider that. Medicare Advantage plans, technically known as Part C of the Medicare family. Once you have enrolled in Original Medicare Parts A and B, you can enroll in a Medicare Advantage plan. Now, these Medicare Advantage plans are closer to a traditional health plan. They have a maximum out-of-pocket amount. Most of them include prescription drug coverage. That Part D is built into the Medicare Advantage plan. There is a network of doctors. Many of them are HMO, so you'll need to assign a primary care physician. And then many of your healthcare services will have a set copay for labs, tests, visit the doctor if you're admitted to a hospital. So they can be a pretty good deal for people. But of course, the Medicare Advantage plan is a little bit more restrictive because it's like a traditional health plan. So you just can't necessarily go any place in the United States and get care, because even though you still have Original Medicare, all of your claims for healthcare services run through the Medicare Advantage plan. They are assuming the liability for all of your healthcare claims and are also administering the Part D prescription drug portion if it's built into the Medicare Advantage plan. So that can be a little bit restrictive, but Medicare Advantage plans can also offer some additional benefits that Original Medicare doesn't, like sometimes dental, some vision, and there's some other little ancillary benefits that some of these Medicare Advantage plans build into their overall plan design. They are nice because everything is predictable. Generally, there is no deductible with many of the HMO plans. So if you're admitted to the hospital, it's usually a per day co-payment. And again, there's a maximum out of pocket. There are PPO Medicare Advantage plans and those generally do have a deductible. So you need to be careful if you have one of those PPO plans and you go see a doctor out of the network, you may have to move through a deductible before they share in any of the costs. The great thing about Medicare is that you have the option to change your plan, your Medicare Advantage plan, or if you're in a Part D prescription drug plan, every year at the annual enrollment period, which runs from October 15th through December 7th. And so if you don't like your plan, you can switch. Of course, if you move to another location, another state, you have the opportunity to change plans as well. So you have some security in knowing that if things aren't working, if your doctor changes plans, you can switch to a different plan. And that's something that you need to pay particular attention to. Is with the Medicare Advantage plans, you need to make sure that your doctor is in there that you want to see, the hospitals you want to see, any medical groups, because you won't really have the opportunity to go outside of that. If those doctors aren't in the plan, you're kind of stuck with it for the year. So there's a lot of good benefits to the Medicare Advantage plan for many people, because they're handling all the claims and everything can be kind of seamless. But for other people that travel around a lot, they may not be the best option, but they're there. And just like the supplements and the Part D prescription drug plans, you must continue to pay your Part B premium. Original Medicare isn't necessarily cheap, especially for low-income people with modest assets. You have that Part B premium, potential deductibles on the Part A, the Part B, the co-insurance, the Part D premiums. It can be overwhelming. There is extra help, and I encourage everyone to investigate it. First, Medicaid, Medi-Cal in California might be able to help with paying the Part B premium and the deductible for Part A and Part B and the co-insurance, if your income is low enough and you have limited assets. And that can be a tremendous value. And they may even actually pay the premium if you're in a Medicare Advantage plan, if that particular plan has a premium attached to it. Now, there is also help from Social Security for Part D prescription drugs. Now, it has a little bit higher income and asset eligibility. So you may not be eligible for the Medi-Cal extra help, but you might be eligible for the Social Security low income subsidy for the Part D, which may cover that Part D drug premium, deductibles, co-pays, and co-insurance. But you need to apply through Social Security. They have all the information, they know what your income is and everything. So always apply. If you have any questions, just apply. The worst that can happen is they're going to say you're not eligible, but they may say you are eligible, and that helps out. So always look for extra help. It's out there, because in addition to Medicare being complicated and a little bit confusing, it can also be expensive for many people. So if you have any questions, I will do my best to answer them. You can leave comments down below. My contact information is on my website, insuremekevin.com, and I am Kevin Knaus for insuremekevin.com.